Good afternoon, everyone. Welcome to Embassy of India Kuwait special Facebook Live. Today is a very special occasion. We have the National Cancer Awareness Day, which is celebrated every year. And today, the Embassy of India Kuwait, in association with the Indian Doctors Forum, is having a special Facebook Live on the cancer awareness. So today we have two esteemed doctors with us, which will be sharing their views, their knowledge about cancer in general and how to prevent it, how to early diagnose it, and how to take care of ourselves. First in line, we have Dr. Susobna Sujit Nair. She is a medical oncologist in the Department of Medical Oncology at the Kuwait Cancer Control Center. She is a recipient of the prestigious the Change Nari Udyami Award 2019 at the Pravasi Bharatiya Divas. She is a member of the Kuwait Medical Association and Medical Council of India as well, amongst many others. So let us hear from Dr. Sushobna. Welcome.
Good evening. Namaste. Salam alaikum. This is a pleasure, and indeed I feel gratitude and thankful to Dr. Vinod Gaikwad for giving me this opportunity to speak something on cancer awareness this evening. Yes, we all understand the term cancer brings about a feeling of great fear. As oncologists, we do understand that the term cancer, neither it means death, nor the fear of death from cancer is so easy. We do understand cancer does make the quality of life of the patient bad, but cancer never causes urgent death or within a short span, the person dies unless it is very late. The fear of cancer is not to get diagnosed with cancer, but the fear is if it is diagnosed late. Among all the chronic diseases that we know, like the crippling diseases, especially like rheumatoid arthritis or bronchial asthma, or say, for example, all the chronic ailments caused by diabetes mellitus, hypertension, cancer is also one of the chronic diseases. But the only difference among all these diseases and cancer is that cancer is a disease which is fully curable, provided diagnosed early. As we all understand, cancer is a disease which starts at the cellular level. That is, its starting point is very small and it remains undiagnosed because of that, because it doesn't cause any sign and symptoms in its early stage. If the cancer is picked up during the early stages, we have a complete cure. Why is so? This is because when we let the cancer remain in our body for a long time, what happens is the cells get a potential or a capacity to destroy the membrane, the basement membrane on which the cells are growing. Thereby, it leads or it enters into the liquid channel, the blood and the lymphatic channel, and it becomes a systemic disease. Once cancer cells gets entry into the systemic disease, there is a fear that it may remain undiagnosed for a long time and may come back in later years in form of secondary disease, which we call metastatic disease. So basically, what we have to understand from cancer awareness is that we have to pick it up early. We have to pick it up before it becomes a systemic disease. Cancer, as we understand, the incidence of cancer is on the rise because it's a lifestyle-related disease. What we are exposed to day and night, day after day, the way of food we eat, our addictions, the cosmic radiations that we are exposed to, the exhaust gases from the different vehicles, so many other ionic radiations, everything can have an effect on the cells. Every cell has something called a nucleus or the DNA, where these DNAs are actually controlling the growth of the cells in the body. Now, if there is any means to damage these DNA, then the so-called process of cancergenesis, which we call carcinogenesis, can start. So somehow we have to see that we are not exposing our body cells to such risk factors. Most of the cancers that we come across, we see that we don't have a direct causal relationship with any of the substances. But there are many risk factors to which we are exposed day and night. Say, for example, obesity, physical inactivity, alcoholism, smoking. These are some of the commonly found but most notorious agents in the society. Smoking, if I start putting the notorious effects of smoking, it will never come to an end. But at least being an oncologist, it's very important to at least see smoking's adverse effects of smoking from an oncologist's perspective. It is said that every cigarette reduces life or longevity by on an average 11 minutes. It is not only by cancer, but smoking can cause many of the other diseases. Say, for example, heart attack, aortic rupture, dental infections, bronchial asthma, chronic obstructive lung diseases, kidney failures. Start from the top, cerebrovascular accidents, arterial diseases, anything and everything can have a direct or an indirect relationship with smoking. It is also said that the carcinogenic agents, as I said, anything that can damage the cells, thereby initiating the process of cancergenesis. Among them, it is said that each cigarette contains minimum of 50 carcinogenic agents that can cause damage to the DNA, thereby causing initiation of the process of cancer. The name of those substances which we find in cigarette smoke are mostly the chemical agents which we find in chemical factories, up to the names like DDT, which it's a which we put in the fields to kill the germs, arsenic, vinyl chloride. Many of the agents are strong chemicals which are not used in our day-to-day life, but those are all chemicals found in factories. Toluene. So all these hard toxic agents are found in cigarette smoke. Are we really justified to put it inside our body, which can really affect the cells which are so benign and thereby causing a DNA change which can in due course of time bring about cancer? No. Not only these toxic agents, cigarette smoke is also found to contain two radioactive agents, polonium-210 and lead-210. And as we all know, radioactive agents don't have a complete decay in their lifetime. They just have a half-life. That means they keep themselves with half-life continuous into the environment. We still get people in Hiroshima, Nagasaki, we still have childbirths coming out with congenital anomalies. That is because of those bombings which had taken place years ago. Those are still the radiations, those are still the ions which are present in the atmosphere of those lands. And the lady who is having a pregnant womb, those cells, the growing cells in her womb, get affected by these radiations and bring about a baby with congenital anomalies. Similarly, these radioactive agents, when they remain indoor, they affect all the passive smokers. Passive smokers, I mean, those who are not smoking, but who are getting affected because of the active smoker, who is taking out all these exhaled toxins inside the indoor areas. So it's not only the active smoker who gets affected, but it's also the passive smokers who similarly get the adverse effects of this smoking. We have to understand that 90% of lung cancers have a direct causal relationship from smoking. Hardly 10% of lung cancer patients have some other cause. Many of us think that cancer is a disease which is only prevalent in families, that is, genetic predisposition. But among cancers, it is only 4 to 6% of the cancer patients who have a familial predisposition. So rest 94 to 96% of the population of cancer patients basically don't have a familial predisposition. That means cancer is not only limited to the families, but it can be in any person who don't even have a cancer in the family. So we have to understand that how important it is to protect our life from these risk agents, risk factors. There is no magical cure in cancer so far. God willing, one day we really come out with some magical cure. If we have something, it is called physical fitness. The more physically fit we keep ourselves, more oxygenated cells we keep in our body, the less the risk of growth of cancer. We have to understand something here. Due to these risk factors, there may be many a times that cancer cells develop in all of our bodies, but it is in our hand whether we give an environment, a culture medium for those cancer cells to grow in our body, or we suppress them with our immune healthy body. It is said in our oncology books that cancer cells cannot survive in oxygenated environment. That means if I keep myself physically active, especially by brisk walking in green environment, that is in an open garden or park, where I can take lot of oxygen in my body, I can reduce the growth of such cancer cells which may be growing in my body, which I may not be knowing, and I don't have a modality to pick up each and every cell in my body, whether there is a carcinogenesis process going on in them. But if I keep myself physically active and I go for a brisk walk daily, I may reduce these risks. People who smoke, they have to understand that God has made this body with many properties to rectify the damages that we create every day. But there is a limit to everything. We have to understand that cancer never grows overnight. If I smoke tonight, tomorrow morning, I'm not going to have a fear of a cancer in my body, because my body cells have a capacity to rectify those damages that has been caused by the smoking. But if I keep on doing the same notorious activity day after day, then surely there is a limit and the body gives up. Then the process of carcinogenesis starts. So basically what we have to understand that we have to protect ourselves from any of the addictions over a long period of time. Somehow or the other, we have to reduce, or we have to put full stop to smoking, alcoholism. It is said that people who smoke as well as who take alcohol, they increase the risk of getting a cancer in their body by 50 times compared to normal person. So just imagine why it happens. This happens because alcohol basically damages the liver. And liver is actually the detoxification center in our body. All the toxins that we accumulate in our body in a cumulative way every day, those are actually detoxified through the circulation through the liver. Now, if the liver itself is jeopardized because of alcoholism, as alcohol we understand it destroys the liver cells, then that means we are generating an environment for the cells to grow and flourish in its own way. In cancer, basically what happens when you damage the DNA which is controlling the cell growth and keeping the body's growth in a controlled way, this mechanism is lost. So cells start growing in an uncontrolled logarithmic scale. So if supposing a cell is supposed to divide and become double in 2 minutes time, if there is no control over that timing, and because of damage to the DNA, then that cell may divide and become double within 1 second. Then just imagine the trillions of cells that our body is made up of. If I give it an environment where there is no control over the growth rate, then what a logarithmic growth rate will start. And these logarithmic rate of growth of cells will produce not normal cells, they will generally produce abnormal cells. Those abnormal cells are basically cancerous. So we have to protect ourselves from all the risk factors, especially our children, because it is understood that the DNA damage is more vulnerable, or the cells of young children which are growing in a fast rate compared to we adults, their cells are more susceptible to damages. So even a small insult to the DNA of small babies can have a worse effect compared to the same damage to an adult. So we really have to protect our kids from that. In today's world, we are also becoming dependent on electronic gadgets. We have to understand that usage of excessive electronic gadgets not only gives us a lot of health-related issues, starting from joint pains, muscles pain, even usage of mobiles on the roads causing accidents. We also find children becoming suffering from obsessive compulsive disorders. They become hyperactive. Unless you give them the mobile, they lose their span of concentration. They start developing dryness of the eyes and whatnot. Yes, even up to the limit of brain tumors. It is shown that the skull thickness of the children, the toddlers, less than 5 years old, their skull thickness is less than 0.5 millimeter. So when we give them mobiles or any electronic gadgets which is connected to the internet, the radiations which are coming to the ear, and through the ear it goes, there's a very thin difference. There's a thin membrane which separates the ear from the brain. So these radiations, over usage of such radiations over long periods of time in the small children have also been found that they may increase the risk of even brain tumors. Are we really justified to do so? Let us protect ourselves. Life is a very precious property that we have got from God. We have to protect it because unless we have a healthy life, we cannot anything that is good or healthy in life. We have to protect ourselves from any disease as such, and not only that, we have to protect ourselves from cancer. We have to understand that if we cannot reduce the incidence of cancer, at least we can be aware to know the early signs and symptoms and pick it up early so that the oncologist can give a complete cure. And cancer will be only in the history that the patient was treated for cancer, but the person will not have a fear of death from cancer. Thank you so much once again for having me here. Stay healthy and blessed. Thank you so much.
Thank you so much, Dr. Sushobna. It was very nice and it was very insightful information that you shared with our viewers. And I hope everyone of us must have taken in the 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 useful information and will definitely apply in our daily lifestyle. Next in line, we have Dr. Mohan Ram, an esteemed doctor who's currently working as a senior clinical hematologist in the Kuwait Cancer Control Center. I welcome him and please share your words.
Good afternoon. Assalamu alaikum. Namaskar. Indeed, it's a pleasure to come here and throw some lights on the cancer awareness. Today is National Cancer Awareness Day, and I would like to thank Dr. Vinod Gaikwad and his entire team from the Embassy of India, Kuwait, for inviting us. It is a pleasure to be here. And thank you, Dr. Sushobna, our colleague, for a fantastic awareness session. Just a couple of seconds before she stopped her speech. Really, I enjoyed a lot today. And she elaborated about the solid tumor, what is the potential causes, how to prevent it, and how to treat in short. Today, I'm going to speak on blood cancer. And that is the second part of the cancer awareness today. As you know, there is solid tumor and liquid tumor. Liquid tumor is like blood cancer. Blood cancer, basically, as you know, normal blood is useful for the body, but if these blood cells getting produced abnormally in the body, blood cells getting released from the bone marrow, if there is some defect in the bone marrow, so abnormal cell production will be there, abnormal WBC, abnormal platelet, abnormal hemoglobin that will accumulate in the body, and it will also kill the normal cells. So that is called cancer, especially blood cancer. It is basically 3 types of blood cancer as a whole, like leukemia, basically disorder of the WBC, lymphoma, it's a disorder of lymphatic system, and myeloma, the disorder of the plasma cells. Leukemia, that is disorder of WBC. As you know, WBC is important component in our blood, which is responsible for the protection of our body from the infection. If there is some abnormality in this, our body immune get disrupted and will get very frequently infection. Secondly, there is a lymphatic system, which is our immune system of the body that also fights against the infection. If there is some disruption or getting produced in abnormal way, and our immunity will be disrupted and there will be infection and a lot of complications. Likely, another thing is myeloma. Plasma cells from where antibody released. What is antibody? As is a like kind of protective component in the body, which also fights against the infection. So basically, if you'll see disruption in the immunity by any mean, by the WBC disruption or lymphatic system or plasma cells. So our body immunity will be low, and there it will be a lot of complication related to this. Basically, the immunity will be low and we will get a lot of infection and complications. So this blood cancer, like leukemia, it has a acute leukemia and chronic leukemia. Acute leukemia means it happens within weeks, like, like 2-3 weeks before you have done some blood test and it was normal, and there is some kind of abnormality in your body, you feel fever, something, you'll do the CBC blood test and it will be, shown there is some abnormal cells. So acute means it is like weeks, and chronic means it like months. This is kind of leukemia in general, type of leukemia in general. And of course, there will be some sign symptom by which we can know there is some problem in the body. Like somebody is having swelling in the neck, axilla, inguinal lesion, or some other places, that is called lymph node enlargement. It means there is something, we have to go immediately see the doctor. And they will do some test and will have some definitive diagnosis. Likewise, if there is somebody is having malaise, like tiredness, feeling uneasiness, some bleeding spots, some like, black spot over the body, and something like bleeding from other places like nose, teeth, they have to go and do some blood test and it will be diagnosed early. Likewise, myeloma will have sometimes bony pains, people have tiredness, they will do some CBC and their hemoglobin will be low, and they will be going through battery of test and will be diagnosed with myeloma. I will not go in detail, but moral of story, like, how you'll detect early. Simple blood test. It can be done any lab that can tell us the abnormality. If some hematopathologists or some pathologists have a good experience, by the one simple blood test, they can know there is some problem. Immediately he has to refer to the higher center and it will be taken care of. I'll give you the example, like patient has some tiredness and he will go to the clinic and he will do simple blood test, like called complete blood count, CBC. And there will be WBC low, or WBC high, or hemoglobin low, or hemoglobin is very high, platelet is low, or platelet is very, various things. It can be shown in that CBC and immediately has to be taken care of. It has to be referred to the higher authority or hospitals that will, taken care of. So diagnosis in time of blood cancer can cure blood cancer. Like chronic leukemia, chronic myeloid leukemia, chronic lymphatic leukemia, if it is diagnosed in early phase, like we have gone for some surgery and we did a blood test for just a pre-anesthetic checkup, and there the WBC is very high. And sometimes people, maybe some other region, WBC is little high, it's okay, we'll follow. No, if there is some abnormality, you should refer, and that person has to go and consult the concerned physician or hematologist to see what is going on. If it will be diagnosed in early phase, like chronic lymphatic leukemia, and patient may not require treatment in 10-15 years, but if it will be delayed and it will involve like some other complications like renal failure or hemoglobin is very low or platelet is very low, then he has to go for treatment. And that treatment, the long process. I will come to the later, this part. But what is my point? Simple blood test can tell us some abnormality, and we can detect blood cancer in early phase, like chronic myeloid leukemia. In 90s, when I was in medical school, the cancer word is itself is lethal. It means nothing can be done. No, it is not like that. Blood cancer, most of the blood cancer is curable now, and there are treatments. Some of the blood cancer can be treated only by tablets. It become like chronic diseases, like other chronic diseases, diabetes, mellitus, hypertension, and things like that. So simple one tablet can control and you can live your normal life. So, but it has to be diagnosed in a time. That is a basic point. So how to diagnose in a time? Just you have to be careful, and routine blood test at least once in a 2 year or a year, you must be doing this test. So don't ignore if there is something abnormal, see the physician and accordingly follow the advice. Dr. Sushobna has mentioned in detail about the causes. In blood cancer, actually, we don't know the exact cause, but of course, what reasons he had spoken, that is related some kind of cancer, including blood cancer, like ionizing radiation exposure to that. If patient has some kind of viral infection like Epstein-Barr virus, it can cause the lymphoma, or like a chemical exposure. If patient has some other malignancy, has gone through the chemotherapy, that may have later on the chances of leukemia. Of course, there are lifestyle. Already Dr. Sushobna has spoken. I will not go in detail, but moral of the story in blood cancer, we should not be worried. We should be careful. Careful in the sense you have to be like, vigilant for your routine and test, and you have to be fit. Like Dr. Sushomna mentioned, you have to do regular exercise and good oxygenation, food and lifestyle. This all matters, in your life. Cancer, what is cancer? Already Dr. Sushomna has mentioned what is the cancer. Cancer is, if something irritating your cells regularly, ultimately it will be like some DNA changes in your cells, and it will cause abnormal production of the blood cell. That is cancer, as I mentioned in the beginning. But today we will not talk in detail. I would like to just express blood cancer. Most of the blood cancer is curable, provided it should be diagnosed in early phase, and a lot of treatment available for the blood cancers. Some of them can be treated by tablet, of course, some of them chemotherapy, and some few of the patient will require bone marrow transplant and cellular therapy. We will not go in detail, but at certain things I would like to tell, like TKI and targeted therapy have come in this era, and further investigation and research is going on. Very soon we will have a cure of most of the cancer, including solid tumors. Thank you so much, and really appreciate, and thanks embassy officials for inviting us. And I'd like to thank on behalf of Indian Doctor Forum to all of you for viewing us. If any query, can come back to me personally or by email, will be shared. Thank you so much.
Thank you so much to our esteemed doctors and to the Indian Doctors Forum for facilitating today's Facebook Live on this very special occasion of National Cancer Awareness Day. And I hope each one of us have learned a lot. And thank you for sharing your valuable information with all of us today. Thank you so much for watching. Keep following us on social media handles as well. Jai Hind.